we have a session on ZeroTrust and Microsegmentation, combat attacks against medical devices and healthcare IoT endpoints. And we're joined today by Emmanuel Jackson, CEO of Everson Technology Partners, and Edwin Menner, Director of Systems Engineering at Cylera. So, gentlemen, Emmanuel, your camera is off, so let me give you a prompt there, and there we go, Emmanuel.
Okay.
You're on the show. How's that?
I would have been really disappointed if you didn't show the suit that I had on.
Well, I'm glad you came appropriately dressed anyway. So.
Hey, that's very important here. Richard, my closet didn't know me.
Mine neither. No, and all my clothes seem to have shrunk a little bit since we've been working from home the last couple of months.
There you are.
Must be something to do with my wife's cooking, but anyway. All right, gentlemen, I'll leave it to you to go through your session. Thank you very much.
Well, thank you.
All right. So, so the subject matter topic today that we're going to go over is how does zero trust in market segmentation work, what it is, and how it can be used to combat attacks against medical devices and healthcare IoT endpoints. That's going to be the focus of this forum today. So as we go through this process, Emmanuel and I put together a collaborative set of slides that hopefully will show you from its operational, from concept to operational implementation and the nicks and knacks about it. So let's start with the quickly with the agenda. Let's see if I can make this thing move. There you go. So we're going to talk about what is at stake. And then we're going to talk about the zero trust architecture in general. We're going to talk about the roadmap to an effective zero trust architecture implementation, as well as the roadmap to a zero trust architecture implementation. Is critical because we need to understand both. And then we're going to finalize with how a second generation healthcare IoT security solution optimizes implementation and enforcement of a zero trust architecture. So let's start with the first step. And I think Emmanuel will be kicking it off. So, well, actually, I'll kick it off. What's at stake? So let's talk about what's at stake and the challenges in the healthcare vertical. So fundamentally, it's all about providing patient care and ensuring patient care. So you can see the tip of the iceberg and then the hidden danger behind it. How do we ensure patient care continuously? Well, there's two segments up to it. If you look to the right, you can see continuous ability to provide care to patients and providers as well. So who are the stakeholders? So generally, the stakeholders are identified below as the clinical biomedical engineering, which we deal with day in, day out, because they do have certain unique requirements that pertains to securing healthcare IoT devices because of their inherent nature of being hacked very easily. In today's infrastructure, they're the most hacked devices, so to speak. They're usually in the clinical biomedical engineering group. Information security, which tries to protect those devices. IoT, which supports information security and clinical biomed to having their operational use. Let's see who else. Facilities, asset management, hospital management team, and procurement, to say the least. So those are the challenges that we have. How do we address our healthcare organizations' continuous ability to provide care? So what is it? What are the security considerations as we move forward into this ZTA or Zero Trust architecture and microsegmentation? What are these challenges, the security consideration? Well, first of all, if you look at the illustration of a hospital here, you can see numerical mapping to a complex environment. So that in itself, that is a bunch of use cases that are just, formalizing itself just by virtue of visual, right? Emergency department will have its own use case. Behavioral health will have its own use case, patient rooms, and so forth. And what affects the use case fundamentally are the healthcare devices, the IoT, IoMT, the OT device, medical device. When combined, they represent a heterogeneous network that's complex. A whole lot of devices are antiquated, archaic operating systems running them that you can't patch, to name a few. So they affect this heterogeneous network and its inherent weak points in terms of possibility to for any kind of exploit It's very proven. As you guys have heard, UCSF was hacked, right? They had to produce over $1 million, right? So this is real. So, and the fact that in healthcare, provider typically have 300 to 400% more healthcare IoT than IT devices, it really enhances the need to have a secured healthcare IoT endpoint infrastructure. So what's next? So what do we have to secure them today? Well, we don't want to currently just say current security approaches are inadequate or insufficient, because all of these devices, as you can see here, are purpose built to do what they're supposed to do. Firewall is supposed to do protection, DMZ, implementation of security, and then you have vulnerability scanner who's supposed to scan the device and provide security posture of the device, a NAC solution that enforces what policy decision point, EDR and UEBI, and so forth. What the challenges between these solutions is not that they're insufficient, it's the lack of integration for automation to optimize their use as an integrated component to secure. If you look at each one of them, they're silos based. Firewall is a silo, it has its own policy, NAC has its own policy, and so forth. So what do we need to, these are the ingredients for success, yet they can't operate together ineffectively as an individuals. So what else do they not consider? If you look here to the right, below, they don't consider clinical context. Key, very important in healthcare. They don't consider device context or PII or business context, and more importantly, regulatory context. So these are the kind of things that as we go through the slides, hopefully the zero trust architecture as a concept and an implementation will make sense. So now I'm going to hand it off to Mr. Jackson here, who kind of is a resident expert in this matter. She'll just go about the zero trust architecture.
Yeah, Edwin, if you don't mind, if you can just move the screen along with me, that's perfect. Thank you, guys. It is a pleasure being here, and it certainly was a pleasure listening to the previous panelists. Especially Dr. Benoit Hansen and actually Bolshe really reminded me of my years in healthcare. When I started off in healthcare, I actually had hair. So, and I don't have any now, and I wasn't gray. I was 19 years old. I was a medical surgical buyer at St. Francis Hospital in Evanston, and really evolved into a lot of different things, new products committees and surgeries and things like that. But what today reminded me of from this previous panel is that what healthcare is all about and how it is quickly evolving, and how zero trust architecture is now needed in healthcare more than ever before. And a lot of things that we look at is needs to be based upon the actual shareholders, the actual stakeholders. And the number one stakeholder within healthcare is the actual patient. How do you serve them? How do you protect them? Which becomes very important in this whole process. And of course, their privacy is very important. That's one component, but the protection of their medical records and the equipment and the people that serve them is actually equally important. So as we look at a zero trust architecture, we look at it as a hardening of the whole IT and security infrastructure for a medical institution. Everything from your network to your medical records to your IoT instruments, which include a great deal of things. That include, your IV pumps. It includes your PCA, the patient-controlled analgesic. It includes your imaging equipment, your CT scans, and your MRIs. So what we need to bring it together is that levels of a zero trust infrastructure that would allow from levels 2 through 7. And that's what we have here. So we look at zero trust architecture. It refers to a security concept and a threat model that no longer assumes that actors, systems, devices, applications, or services operating within a security perimeter should be automatically trusted. That our goal is that on a hardened zero trust architecture, we are to trust nothing. And that allows us to move forward. So we look at things from a macro level all the way down to a nano level. And we'll get into more of what solutions that have been created with Cylera and IBM, and our other partner, AppGuard, that Cylera and Everson Technology Partners got together at the beginning of a COVID, in response to COVID, to come up with a solution we think that will have a positive effect on the IT infrastructure and medical and IoT devices across the world. So we look at things at a macro level, the system level implementation. Each HIoT asset must be verified, and all traffic to and from that device must be accepted. Now, we consider that to be normal to the devices and operations in normal business requirements. At a micro level, device level implementation, as it reads here, it should have zero trust architecture protection at the device to the level to trust but verify. Everything has to be operational, things have to work. Challenges users' devices. This should be accomplished passively in an agentless model method, as HIoT assets often falls into an unmanaged device category. Many hospitals are still trying to figure it out. Many healthcare institutions are trying to figure it out. But also, we have, more important during COVID, our research institutions are trying to get this figured out, as well as we're seeing an exponential level of actually hacks, that is actually happening now. But also, we get to the most minute area of this platform, and we talk about an infrastructure. It's all about hardening the whole security platform. It's about managing these assets. It's also about making sure that the necessary doesn't happen. So the nano aspect of it is application level implementation. Securing the applications that goes on to many of these devices and utilities. Level ensures that applications and utilities seeking cannot go rogue, and use controls may be directed to allow hijacked applications to download, execute malware, steal credentials from the memory of other applications, allow remote execution, attacks from other endpoints, etc. Neutralizing the nano within HIoT neutralizes the macro before it manifests its proliferation throughout the network. This needs to be accomplished passively and through an agentless device security method. Now, what we call this at the nano level and the implications of these things, we often call that ransomware. We've seen it happen throughout hospitals across the world. We understand that healthcare data is the most valuable data in the marketplace. And we're finding that the cost of it, we saw the University of San Francisco situation breach that cost $1.2, $1.4 million. That's exceptional, because 5 years ago, the average breach was $3,500? And now we're into millions of dollars, because these people do understand who they're hacking and what the implications are. And we think that having a zero trust platform along with the asset management aspect of what we're going to talk about today becomes very important. So I'll pass you back off to Edwin, and we'll get to more of this later in the presentation. Thank you.
All right, thanks, Emmanuel. So let's see here. So to continue the process, what is the microsegmentation initiative? What is it like? So we're going to talk really briefly on it. There's a lot of bullet points here, but we're going to generalize it. So microsegmentation traditionally utilizes the employment of role-based access design, utilizing dynamic VLAN or role-based on Active Directory or whichever database or device MAC address if it's doing MAC auth bypass. But it requires a supplicant or agent in every device in order to accomplish the traditional method of microsegmentation. It also utilizes DACL or dynamic access control as part of the microsegmentation to support each VLANs, which is the inherent nature of microsegmentation, VLAN or subnet segmentation, they call it. And so other details that support the initiative of microsegmentation is the current complexity of the heterogeneous network that we're exposed on, especially in healthcare environment or medical facilities, makes employment of DACL and dynamic VLAN across wired and wireless very unpredictable and they can't really provide network access that's true to its form in terms of the mission criticality purpose of each of these devices. Therefore, the implementation of downloadable ACL and VLAN does not scale inherently because of the manual manpower resources to configure switches and such for this to work. So what do we do next then? Well, we talk about Zero Trust implementation roadmap. Let's talk about that for a second. So how does this work, the implementation? Well, first, fundamentally, control of healthcare IoT devices should occur at layer 2 switch. So when we're thinking about the concept behind Zero Trust architecture, we must ensure that in that concept, healthcare IoT should be at layer 2 switch and not the firewall. Because fundamentally, firewalls does not have east-west traffic flow visibility or traffic visibility within a broadcast domain. That means peer-to-peer, which I'll go over later on. And also, we must be able to implement device category profile based on policy where a device is assigned to a policy based on its device type or category or operational purpose. This kind of policy requires or a need for an accurate representation of what the device is first in terms of visibility. So to offer this consistent policy regardless of device type, access medium, and or device location. So that visibility is key to getting that. So to address the challenge of constantly renewing IP address, implement technologies such as scalable group tags or security group tags. Either way, this is a known acronym, SGT they call it, where the policy remains associated to the device's group category or type based on the policy enforcement or policy decision point like a NAC. And then and then the SGT utilizes the DACL behind it to support the unique implementation of access control lists for each device, again, based on its mission function, so to speak. So that's the overview of Zero Trust implementation in the first set of slides. This is now a graphical representation or illustration of how typical subnet or microsegmentation is employed in today's infrastructure. As you can see database server, VLAN 800, it would have a supporting set of dynamic ACL. But in the next iteration, as we go through the second generation implementation with device solution that provides visibility, you can actually get inside the clinical services and actually based on clinical devices, device type, device category, and function, you can create even more enhanced VLAN and SGT inside the VLAN itself. So that's what makes this unique. But fundamentally, the whole idea here is to show you an illustration of how subnetting or microsegmentation is employed today. And then another part of it, of Zero Trust implementation, is to identify your sensitive data at rest and in motion. Of course, this is critical. Perform data discovery and classification and segment the zone based on organizational department or device category classification. Classify all resources involving the electronic exchange of sensitive data. Basically look at the workflow of the data, the actual traffic flow. And this is a graphical representation of the east-west traffic. As you can see, the medical device is picking up a DHCP from different VLAN, but the medical device, the source, is coming from VLAN X500. And then the pump server that is talking to is inside VLAN X500. So you can see how it traverses the same device, medical device, resting on the same VLAN, is communicating with a pump server in the same VLAN on the same broadcast domain, but it's transitioning through a switch, through a different Wi-Fi, different access device, access methodology, Wi-Fi, and then going to the wired, and then back to the wired, back to the Wi-Fi again. So this is the kind of heterogeneous complexity in terms of access that's considered as part of the success or failure of implementation of Zero Trust architecture. Why is that? Because this is where you define the ACLs and the guidelines that you want to set on those VLANs to control and have visibility of the east-west traffic. And that's the point of the slide that I just went over. So in order to do that, you must architect a Zero Trust microperimeters. A little bit too much detail here, but microperimeters, zones, and segmentations around sensitive data should be accomplished and enforce segmentation using physical and virtual security controls. This is one of the topics that Emmanuel talked about earlier. It's all about virtual security controls in the application layer as well. Establish access based on these controls and microperimeter design and automate rule and policy baselines to audit and log all access change control. This is all operational Zero Trust implementation concepts. So in the end, this is the result of a zero trust implementation concept. When you have visibility, you understand the subnet breakdown of what medical devices are, the non-IoT miscellaneous and infrastructure. This kind of output or visibility is critical into a successful zero trust architecture in order for you to identify how you're going to segment, how you're going to create policy based on mission criticality components or function of each device. You have to understand how many devices there are on the medical field, on non-IoT or miscellaneous, even to the field of categories of each type of those devices. You must understand how many devices are sitting on these subnets. So now you have the visibility that you need to make an informed decision on how you're going to fundamentally do your segmentation. So to continue the zero trust implementation concept, we must embrace security automation and adaptive response. This is all about automation at the end of the day. We talked about that in the beginning of the slides where you had UEBA, you had NAC, you had firewalls, you have all these best in breed purpose-built platform that executes for security purpose, but they're all silos. So how do we do that? Is embrace security automation and adaptive response. To get the adaptive response, first you have to translate business process into technology automation. And then you can leverage existing security analytics solution or a third party's best in breed purpose security solution within the organization to correlate policy and procedures for automation and determine what can be lifted from manual process. Because at the end of the day, when you have a fully integrated solution with ticketing system, and you'll see that on the next slide, you'll be able to accomplish what I call in Jerry Maguire's movie, the Quan of networking. Okay, so how do you accomplish that? If a new third-party solution is needed, identify a vendor. Make sure that it's moving in the security direction of your zero trust architecture strategy, because that's critical into you making an investment for future-proofing your investment. So now here's what it's all about. We call it Cylera automation solution architecture, but really this is a very nice representation of a fully automated solution that solves a lot of the issues of operational day-to-day issues by combining and integrating all these critical components by virtue of fundamental visibility. You have to have visibility in order for you to command and do API integration and affect. For example, I like to talk about the SOAR piece. So this would be what would represent a sensor on-prem platform that's discovering all these that are connecting to these devices on-prem. And then this would be talking to a cloud, for example, which has the AI, ML, threat intelligence, industry intelligence, and asset intelligence all synchronized with this platform that are integrated with these solutions. And by virtue of the output of the AI, ML, now you have the ability to create policies or provide the necessary attributes to enhance the SOAR, the orchestration platform's capability to create. For example, so in Cylera solution or AI machine learning based solution, we can see, for example, the firmware update. It needs to be updated. It's out of patch. If we can send that attribute, which we do, to an orchestration point, that orchestration point can set up a playbook to automate the patch update to something like a big fix automation. So now you just automated the firmware to secure to proactively secure in an automated fashion devices that would otherwise have to be manually patched. And at the same time, any kind of policies that are created based on attributes and detailed visibility information or security posture information output from the AI-based cloud solution can now create policies and inject those policies to do active enforcement on the firewall, both north and south. And all this is fundamentally key is because we can see the device. If you can see the device, you have those subnet mapping that we just showed you. You know and understand where all these devices are. Those are the critical components of what makes for a successful implementation of zero trust architecture. So now, what does implementation roadblock entail? So what are your roadblocks to consider as you move forward into ZTA or zero trust architecture? Well, you must consider that prevent poor planning and transitioning existing networks to zero trust architecture. It's all about migration. Make sure, again, to acquire products that fundamentally and seamlessly enable ZTA as your strategy requires to support wired and wireless. Using, for example, a NAC platform would be a great asset to either, if you have it already, to enhance it, build it out so that you can create that as a central point of policy decision points. Improper planning and implementation of layer 2 architecture should be highly considered because that's key, right? Having proper planning of your layer 2 VLAN architecture and supporting access control is going to dictate how well your policy decision points are based on visibility of security, and the device itself will depend on how well it can execute the actual enforcement based on device type and into a particular VLAN or subnet that's protected based on its mission component of the device. And then one of the other things to look for is did you factor training in? Training. This is like more often than not looked at, right? Overlooked. We don't factor training of network and applications engineer to develop and support this robust ZTA architecture in operational environments. So always plan that as part of the potential roadblocks to a successful Zero Trust implementation. And then vulnerability management. Of course, that's a must. That's integral to the whole success and failure of any security initiative, right? So ZTA or Zero Trust architecture inherently unable to protect IoT device with vulnerabilities which can inherently bypass existing policies today. So you have to identify those vulnerabilities before you can actually protect those devices. So, so to protect an IoT device through ZTA, the device business medical purpose or mission components purpose, along with the associated rest of the device purpose, must be accurately defined. Again, that's part of visibility, that's part of Zero Trust. And then the ZTA must define a healthcare exploitability as well. And there needs to be a system to identify published vulnerability that it can use as a reference point to define what the device should be and what actions need to be taken in terms of incident response for this particular device. So one of the key components is east-west traffic. As you can see here, I need not go over it, but UPnP, ARP, GARP, IGMP layer 2 protocols are often exploited because you can't see, it's not going through the firewall. It's going straight east-west peer-to-peer. So when it's peer-to-peer, the only way you're going to successfully mitigate it from infecting the rest of the devices within its broadcast domain is to have visibility fundamentally. You can see configure as a layer 2 worm right there. It looks like a little worm. And it's actually going east to west. It's that red arrow. That's where configure rests and does its damage. And oftentimes, how are you going to protect a ZTA architecture if you don't have visibility of east-west traffic? What tools do you need to make for a successful implementation? Is a visibility, have the tool that has the visibility for layer 2 east-west visibility. So let's see. So another key point is how do you use your existing CMMS or database or ticketing system is key here. So we talk about real-time dynamic information of DHCP. That's oftentimes very hard to track by the existing CMMS today. So you need to find your rapidly changing information and synchronize that with unify that with your CMMS database. How do you get that? What kind of solution requires that? And other information such as how do you find the categories of these devices in contrast to what you have in your database so that you can get an accurate representation of your device or asset inventory. So, and then how do you capitalize on the existing ticketing system so that you can provide an automation process? What are the ingredients? So when you have a properly architected ZTA, you'll be able to synchronize with an asset discovery platform like a CMMS and pull asset from a CMMS and merge using all these dynamic information. You can then send asset risk assessment. You can then have security controls, optimize, and do a gap analysis. These are key. These are key components of how critical it is to synchronize and unify your asset information database. And that's, again, key ingredient to a successful Zero Trust implementation, architecture implementation. So how do we leverage that? So we leverage using next gen or second generation IoT security for Zero Trust initiative projects. So it has to be passive. First of all, in order for you to have the visibility to a successful Zero Trust architecture, you need to identify those devices. These unmanaged devices, these MRI that you can see here, these pumps and infusion pumps, and you can see the ventilators are highly mobile, but they oftentimes run an archaic or antiquated operating system that's you can't patch, and you can't put a client or a supplicant or an agent on them. How do you secure these devices? the best way to secure them is to first identify who they are, what they are doing, where they're at in the network, how secure they are in the network. And if you could do that passively on a solution, then you got the best of both worlds, because you're not having to actively scan and take these devices down to identify what they are. Once you have the identification piece through passive agentless deployment model, now you have the visibility piece. And inherent to that visibility piece, you'll be able to now identify the security posture. And if you have a real-time AI machine learning backend working for your solution, now you have real-time active security posture of the device at any given time. It changes its posture, especially the application. This is the core and the crux of ZTA architecture, because one, it's passive, two, it's agentless, and three, you can put it in, it supports any MRI or any healthcare IoT devices out there. It scales, is what we're saying. And it scales because we have an AI machine learning backend to support that scalability. And how does it do that? So for example, a little bit on the detailed side, but if you follow the line, basically we pick up the data from a span port on a switch or a Gigamon, a packet broker. Then we send the Cylera information, alerts, context to a NAC or a firewall through RESTful API integration. Then the enforcement begins on the firewall, and it sends back the intelligence data back 4 and 5. The NAC would send its database synchronization to our solution or an AI/ML-based solution to synchronize that database. And also, firewall can use firewall logs. So something of a Cylera solution can pick up the firewall logs and determine even more information about the device visibility and its inherent security posture. So this is just like a very high level. So I made it as simple as we can to show you a graphical representation of how it operates to do the enforcement using the actual information from the NAC and firewall to the AI/ML backend Cylera solution. And so overall, you know, and this is the best part, once you have this, I call it the quan of networking, now you'll be able to do your automated patch update. You'll be able to generate automatic ticketing system because you're going to use the information on visibility from the solution to provide an accurate representation of what the device is and what vulnerabilities, risk, and what incident response, what action remediation task you need to do. And while you're getting that, while the engineer picks that automated ticketing system ticket with all that information to tell the technician where to go and how to fix it, it's centralizing that same information with the CMMS database. All the active and dynamic information is synchronizing, so you have no gap differences between your static CMMS and the actual dynamic inventory provided by an AI/ML background solution. So, you know, and then to further enhance that, if you have a NAC or a firewall, you can actually create policies based on an accurate representation of the device and a security posture that's unique to that device's capability and mission component criticality function, and deliver that microsegmentation that you intend to, or do an actual potential quarantine of the device. And on the same note, via RESTful API, firewall can again accept dynamic ACL, trigger existing ACL, do SGT enforcement, and then at the end, the other two is a SIM platform, integration with a SIM platform to centralize all your logs and reporting and automate that process as well to work with a SOAR product to do actual enforcement. The SIM can actually work with the orchestration platform. So if you look to the left, medical devices, healthcare, IoT enterprise, OT infrastructure service, and IT are all devices that are oftentimes unmanaged, and the only way to actually, and you can't put any applications on them. Only way to discover them or identify them is through a passive discovery. And so now I'm going to hand this off to Mr. Emmanuel Jackson.
Well, thank you guys very much, and thank you, Edwin, for that. You know, you gave a great deal of information. I think it leads to what I consider the crescendo of what we are here for and what we have to offer. As you guys read there, that says Everson Technology Partners, powered by Cylera and IBM and AppGuard. Cylera and I and Everson Technology Partners came together at the behest of IBM back in February. And the purpose of that was to create a response to COVID-19. And at that time, we didn't know how broad that would actually be based upon the level of the pandemic and really, and I had some great ideas about what the needs of hospitals were or actually would be. And how could you affect, you know, patient care and those type of things. And so building a complete layer of asset management, zero trust. And I know this portion is about zero trust, but in some ways is about so much more than actually that, because in many ways it's about saving lives with the asset management aspect of this thing. And so how I got excited about the idea is creating a cybersecurity platform with asset management of medical devices, which is critical to the marketplace. But what happens when you have the ability to track, you know, medical devices from all over the country? If you can have these Cylera sensors in to hundreds of hospitals across the country, in Florida and Georgia and Texas and California, where those hotspots are now, and that if you can have eyes on glass to manage that process, and what does that process do for you? If you find yourself in a situation where you're a hospital in Pennsylvania, if you're in Pittsburgh, and you need 100 ventilators, and yet we can, you know, identify for you easily within Philadelphia, there may be 50 there, or there may be 50 in Chicago. And those things become critical in being able to get those items shipped and where you can actually save lives. So that's a critical part of what this process does. As I listen to James Balshi talk about the cloud and the cloud versus physical infrastructure, and basically the hybrid of that, and actually what does that mean? I heard Dr. Hansen talk about the efficiency of the system. We've done a lot of work when it came to actually genomic data. You know, every other year, in the last 2 years, there have been more genomic data harnessed and created, and that's more data than it was in even human history. So as we look at the actual needs, what we have be able to create is a partnership, and we've created in that partnership the Healthcare Asset Operations Center, which is located here in Chicago. It's a brand new center. It was created this time last year. It was built this time last year, and it was created this past spring in response to actually COVID, where we have created a platform that is the technical sensors from Cylera, powered by that and their AI and IoT technology, along with our partnership with the platforms of QRadar and Resilient and the X-Force Red platform from actually IBM. And then within that process of actually zero trust, where we are securing this process from AppGuard at the servers, the workstations, throughout the whole process, to make sure we have a level 2 to level 7 zero heart and trust platform that would secure the enterprise, that would secure the devices, and would secure the patients. And I think, in a sense, we give a great deal of security to, and I believe security in healthcare is a national security issue as well. So we have built this platform to offer a level of support to hospitals and healthcare institutions and research institutions on a SaaS month-to-month subscription basis to help you manage that. So I'm sure we can have further conversations coming into the future about it, but just wanted to really, you know, let you guys know what is out there, and you know, make it a very strong point that we have created this platform. We are here to have conversations about it with you guys, and we think that we can have a huge impact moving forward, both in small institutions, because it is a service. We can help them. We can help hospitals in actually rural areas, and we certainly think that we have something that is very unique and different that we consider one of the first clinical SOCs in the entire world. So we look forward to having this conversation. I thank Timur. I thank Richard. Richard, I didn't know you had such a fancy British accent. And so I thank you all.
I'm losing it actually, so I'm losing my voice here with all the emceeing today. But it comes out occasionally. Should we put it that way?
Thank you.
Yeah, thank you very much, Emmanuel, and you, Edwin, for some great information there. There are a couple of questions from Inderjeet and Stacy on the Q&A. So in the interest of getting back on schedule, since we ran over time here a little bit, I'm going to let you respond to those directly via the Q&A application, and we will, in the meantime, move on to our next panel. So thank you very much again for that session.